It is 1:30. Let's get going on the meeting. So I will call us to order, and I'll ask Mr. Westerson to do a roll call. And this is where Deputy Mayor Middleton Hope gets to play with his microphone for the first time.
Yes. Thank you, Councillor Croson. Councillor Carlson. I think he's going to be late, is what we've heard. Councillor Dodick.
Present.
Thank you. Deputy Mayor Middleton Hope. Present. Councillor Croson.
Present. Thought I did. I'll move on to the acknowledgement statement. The City of Lethbridge acknowledges that we are gathered on the lands of the Blackfoot people of the Canadian Plains and pays respect to the Blackfoot people past, present, and future while recognizing and respecting their cultural heritage, beliefs, and relationship to the land. The City of Lethbridge is also home to the Métis Nation of Alberta, Region 3. Moving on to the adoption of the agenda, I have a motion from Deputy Mayor Middleton Hope. Be it resolved that the agenda of the Governance Standing Policy Committee meeting of September 21st, 2023 be adopted as presented. Deputy Mayor.
Thank you, Madam Chair. Are there any additions, alterations to the document?
Only to the one you have.
Apparently. But other than the one that I have, are there any additional changes?
None from our perspective. Thank you.
Thank you. Then I'll call the question.
Question's been called. All in favor? Passes unanimously. We then move to our consent agenda, and we have the meeting minutes from June 22nd and the status of initiatives from for today. I have a motion from Councillor Dodick. Be it resolved that the minutes of the Governance Standing Policy Committee meeting held on June 22nd, 2023 be approved, and the Chair and City Clerk Designate be authorized to sign the same. And further be it resolved that the status of initiatives for September 21st, 2023 be received as information. Councillor Dodick.
There. Unless there are questions, comments, or concerns, I would call the question.
Question's been called. All in favor? Passes unanimously. Now moving forward to our first presentation, website progress report. We have Ms. Grindle and her team. So Ms. Grindle, we'll hand it over to you. And I have to tell you, as you're moving up there, I asked on my Facebook page if people liked the website. Only got one response, but they loved it. So 100% from one person.
You can hit the button on there, too.
There, I'm good. Okay. I got her figured out. Technology. Thank you, committee members. I am Tara Grindle, Communications and Engagement Manager here at the City, and I'm joined today by my coworkers Wes Chapman and Gordon Prest, who have done the bulk of the work on the redevelopment of our website, and we wanted to bring a progress report to you today on how things have been going. Next slide, please. So as you may remember, we started this project back in 2021, and it was required to replace an aging content management system that we had the current website on. In 2022, we engaged with a vendor named GHD Digital, and that was an agreement done through a group purchasing organization, which resulted in the financial and some labor efficiencies for us. And we were able to move along quite quickly as soon as we got on board with GHD, and the new website launched on April 24th, 2023. Next slide. So just a little look at some of the success we've had so far. Accessibility was a huge factor on the old website, and we've been able to see quite a significant improvement in that. You'll see there 61 out of 100 was the accessibility rate of our old website. We're now up to an 82.3 out of 100. A lot of things that we changed. A lot of the writing, just making sure that it was written to the appropriate grade level, that we were using less things like PDFs and images and that aren't as accessible. It's mobile friendly. About all those things helped us to improve that accessibility rate. And there are some provinces, Ontario one, that already have some mandatory accessibility requirements. So if that comes to Alberta now, we're really in a good spot to be able to meet those if we're mandated to do that. And also just makes it much easier for our residents to use. There's also a measure called the Digital Certainty Index, which takes a look at the quality and the impact of the website's presence, and that has also increased. We were in about the mid-60s out of 100 with the old website, and that's now at an 80.9, which is more along the industry standards. Next slide, please. There you go, the puppy. Another one of the successes of the website launch was we had a community photography contest. We had more than 75 entries, and the winning photos will be featured throughout the website at various times. And that adorable puppy is one of them right there, and you will see some more of the awesome photos we received throughout the presentation. We've also seen a lot of operational efficiencies. So on the back end, it's much more user-friendly. Getting information up on the website, being able to organize it, it's just way simpler for our staff and way more efficient. Also, the subscription service for our team has been a huge efficiency. So now that you can subscribe to the news on the website, that eliminates us having to keep up distribution lists and put things on the website and then email them out to a group. As soon as it goes up on the website, it just goes out to everybody who's subscribed to that news section. So that's a huge efficiency for us as well. Next slide, please. Another big one, obviously, is that the website's secure, so that helps make sure we have less cybersecurity risk. The content now is way more resident-focused, so instead of putting every bit of information we have about every department we have and organizing it based on how we are organized within the city, we really took a resident focus. We did some exercises, a tree jack exercise, which was one of them, to see how would people navigate, how would they look for things, where would they look for things. Obviously our search function is working much better, so all of those things are helping bring it more to a resident focus. The information about programs and services is reaching more people because they can find it more easily, and the project was delivered on time and on budget. Next slide, please. So another one of the features of the new website is that we can do a little bit of surveying with it. So we were able to, actually doing it through our Get Involved website. We just put people over there to give us some feedback on the website. This was within about the first month of it launching. So the 45% of respondents rated it a 7 out of 10 or better. Councillor Croson's survey was 100%, so we could go with that one too. So we obviously, we know we still have some work to do there, and there's some improvements, and this will be an ongoing feedback loop with the residents. There is a desire for more online services and some more online problem reporting options, and we've actually tweaked some things just as recently as last week to really highlight in our I Want To menu where you can report some of those problems online, and working really closely with our 311 team to make that a little bit more obvious for folks where they can provide that feedback, and that's helping a lot. We've seen a big improvement there already. So we'll keep doing those kind of tweaks and things like that, but we also heard from that survey that people were finding the search function much better, the navigation was easier, it was easier for them to find the content they were looking for. Next slide, please. It wasn't all roses, obviously. We had some bumps along the way. So that content cleanup was a huge amount of work, and I have to commend these two fellows sitting back here because they put in some really, really long hours for a few months there. We went from 2,000 pages on our old website down to 400. So that was a lot of consolidating, a lot of rewriting, and a lot of work from our departments too, because it was a different way of thinking about things. They used to put everything they had up there, and we really had to have everybody evaluate what's of value to residents. What is it that's going to be important to them? What do they want to come here to do? They don't necessarily want to come here to read a 800-page document. So we needed to figure out where that balance was, and it was a real change in thinking for a lot of our departments, so that was a lot of work. When we signed our contract with GHD, we were going with a content management system called iCreate. So we started down that path with them, and then in about January, they said to us, we're going to launch this new content management system called GovStack, and it's brand new, and you guys can be the first ones on it. So it was scary, but we knew that it would only make sense to go with the latest. We didn't want to be behind when we launched. So we did go with the new GovStack content management system, and there have been some struggles obviously, you probably have seen a few of those. Some of the search functions didn't work right off the bat, and there's been some things, we've had the news articles that took us a while to get some of those things up and going. So we have been working through a few of those, and we continue to work through some of those. I think for the most part, everything on the public side now is really solid and good. There's still a few things in the back end that we're still trying to work with and a few functions that we're trying to get. But we were the first municipality to go live with this. So there's definitely some learning experiences, but it feels good to be on the leading edge of things as opposed to being on our back foot already. So next slide, please. So the next step with the website is continuous improvement. We're going to continue to work with our vendor to resolve any of the issues and any of the other functionality that we don't have yet that we were expecting to get or we want to add going forward. And that's the beauty of being on this new GovStack, is this is where they're putting their effort and where they're putting their work to grow it and make it bigger and better. We're going to continue to use that resident feedback to make any changes, work with our departments to evolve and improve their content, and then we are continuing to champion and support any new website elements that might be coming down the road, and we've got a few of those in the hopper already. Next slide, please. If you remember back to the launch of the website, there was a phase 2, which was a citizen portal. And this was intended to have a place where people could log in and they could get customized information. This was things like they'd be able to see their utility bills or their tax bills, or they'd be able to say where their house was and what facilities were near them. And so as we started with the website, as we kind of finished with the website project and started moving into phase 2, we started to take a deeper look at the citizen portal. Next slide, please. We did a cost and benefit analysis of what was there today. And what we really found was a lot of redundancy, is it wasn't going to do much of what the website is, anything more really than what the website was currently doing for us. And so to encourage people to log in and to do this when there wasn't a lot there that they couldn't already do on the website, felt like it was kind of a waste, and it would be a lot of staff effort, a lot of effort on the residents' part for not a lot of benefit. We talked to another municipality who also has the citizen portal, and they said really the benefit that they saw was when they could do some true integrations. And so even though the vendor says they can integrate, there's a ton of work that needs to be done on our side to make sure that those integrations can happen. And we weren't in a place where we could make those happen right away. So we knew launching a portal with not much in it was probably a waste of time and money for folks. So we decided to cancel that portion of the project and just put our efforts into the website and making it the best we could. We know that there is still some maturity that needs to happen with that GovStack content management system to make it work well with the portal as well. The portal kind of was a product they had before, and now that they have the new content management system, there's still some work to make sure that those things can merge together. And then just the staff capacity to be able to do that wasn't there. So there will be some cost savings there by not moving forward with that part of the project. And I think that is all I have for the presentation. Are we done? Yeah. So if you have any questions, we'd be happy to answer them. And if they're technical, I'll get the guys to help me.
Well, thank you very much for the presentation. And yes, I don't see anyone in the audience. I don't think we have to ask if there's any public who have questions, so we will move to council questions. And our first person up is Deputy Mayor Middleton Hope.
Great, thank you. And thanks for the presentation, Ms. Grindle. You touched on this, but I wanted to give you the opportunity to provide full credit. Did you indicate that the project was on time and on budget?
Correct.
That is correct.
Yes.
Well, congratulations.
Maybe under, I guess, if we're not going to do the portal.
All right. So you get to brag about that, which
Yes.
is important.
Yes.
I have a secondary question in regards to the GovStat program.
Yeah.
And I have some experience in this area where we've gone with an untested product, and it has turned out to be less than what we'd hoped for. So do we have guarantees from the organization that is providing this? I presume it's a software program. Are they in a position to provide us with a guarantee on the work? Are they prepared to stand behind their products so that if there are costs incurred, that we can recoup those costs? I wonder if you could perhaps address those two questions.
Yeah, so we've been working with them really closely this whole time, and we do have an ongoing contract with them, right? So this isn't something that our IT department manages. This technology sits with them. It's their technology.
Yep.
So they will be providing us support on an ongoing basis at this point. And so, yeah, I mean, we're kind of their flagship. We're the ones that they want to show this product to other people for. So, you know, we definitely spend a lot of time going back and forth and pushing them. There's updates happening kind of all the time as they learn things, and there's new things put in the hopper. Guarantees, I mean, I think the guarantee is this is their product that they're trying to sell to other people. So
Yeah,
that's probably the most guarantee we can get.
I'm just wondering if any of your staff have a different perspective that might assuage some of the concerns, because these projects, as you're probably well aware, can sometimes get away from them. And as much as they promise that the product is going to produce, it often does not, particularly when we're dealing with a technology issue. And so I just want to ensure that if we're going to go down that pathway, and the product is going to be an expensive product, I presume, at the end of the day, we want to make sure that it's going to do what we ask it to do.
Yeah, and of the contract we had with them, of what it was going to do, it does everything it's going to do that they said it would do. It does. There's some things we still want to tweak, or there's some things we think could work better, and that's what we're continuing to push for. But when we went through the list of things that they said it would deliver, it does deliver those things at this point. So that ongoing kind of maintenance stuff will be to help us kind of, and help them grow it and continue to add more things. So there's just one other piece that we're still waiting to bring on, a microsite piece, and we're still working through a few of those pieces. But other than that, it does everything that it says it would do.
Okay.
Yeah.
Last comment. I take it then they would like to use Lethbridge as a springboard to other communities?
I think so, yes. Yep. for
Okay,
sure.
thank you.
Yeah.
Councillor Carlson.
Thank you, Madam Chair. And again, my apologies for running late. I was in a meeting with the ministers, who I think will be joining us at the end of this meeting. Thank you, Ms. Grindle, for the update. Two quick questions. The Citizens Portal. I couldn't quite figure it out from the material presented. You said we're not going to go forward with it right now
Right.
because there were very few things that it could do that we can't already do. Can you give me an example of what it could do that I couldn't do already?
Of what it, like today, or if we were able to integrate things?
I have no idea. I was just trying to wrap my brain around what a citizen portal could do for me that I couldn't do today.
Right, so it would be logged in, and you would have, it would have your address attached to it, right? So ideally, and I think the big one from Medicine Hat that we talked to was their tax bills integrated. So you could go in and see your assessment, and you could see your tax bill and that sort of stuff. We don't have that capability. So ours would be more like, it would take all of the things that are on the website and put it in a nice, like, central location for you, instead of you having to go, like, you could say, I want to know the swim schedules for this pool, and it could kind of make you a little dashboard like that. But those are all things that if you knew where to find them, and they're fairly easy to find on the website now, that probably wouldn't be a huge selling feature for you.
Okay, thank you for
Yeah.
that.
Yeah.
Second question, I think you said in June we completed a resident satisfaction survey.
Yeah, of the website, yeah.
Is that going to be replicated again next June so that we can
Yeah,
show
for
some?
sure.
Okay,
That'll be part of the ongoing, we've made a few tweaks now already based on some of that feedback. And so I think we want to go back and check how that's working. We've got a lot of data on the back end. We can see where people are going and how they're getting to things, but also just doing that pulse check and that temperature check with the community, and figuring out what it is they still want, so we know what to work on next, kind of thing. Yeah.
maybe following up on, are you still Deputy Mayor? Yes, Deputy Mayor Middleton Hope. It's not the first of the month yet, so yes, you're still Deputy Mayor. Question about the vendor wanting to use us as the springboard, or do we get a cut? I'm cheap.
It has not been agreed upon at
Okay,
this point.
thank you.
Thank you, Councillor Carlson. So one question I did have from people, and I think this has been worked on, but it was certainly on early on in the project, was non-working links. Have we had a chance to correct those, or is there a way people can report those?
You gonna take that? I'll let the technical guys answer those.
Hi, yes, so we have a system in the back end that checks all those links. We had some issues at the beginning of the project. We get a report out now that we can go in there and fix those links up as they come up. So residents can submit anything to our web feedback at lethbridge.ca, or that we will get a report, like I said, weekly, that allow us to go into the back end, fix them up, and then have them good for residents.
Okay, perfect. Yeah, I'm getting fewer complaints on that, but I know it was really when we just launched it that I was getting most of those.
Some issues with the news section of the website, which was giving a lot of those link issues. We have fixed that up, and that has solved a bunch of the problem.
Okay, perfect. Thank you very much. So I'm going to now be that person. When we buy a truck for transit or something like that, we have a sense how long it's going to be. How long are websites lasting municipalities now? How long are we going to have this? And when do we start planning for the next one?
Oh, goodness.
But I mean, just wondering about how that technology works now and long-term budgeting.
Yeah.
What do we do now?
Yeah, and to not get to the spot where we were before, right? And I think, so our team's taken on a big role in the website now on the content piece of it, and having the technology sort of removed. It doesn't really matter what technology it sits on. We've got good content now, and we can move that to whatever we need. I think that that's a big piece of it. But this is like the #1 communication tool we have, so we're putting a lot of effort into it, where before there wasn't one person or one place that it really lived and owned. So I think that we will definitely be keeping a much closer eye on it ourselves as a department to make sure that this isn't to a place where it's not effective, and always looking for how we can do that continuous improvement. And the guys know more the technical side of it, but I think, like, how do you explain the more open, Gord can probably explain that piece of it.
So the system we purchased through JHD is an open source system called Umbraco that we can continue to grow with them as they have other municipalities being onboarded. We can use some of the additives that they have added into the program, and they'll be given to us as well. Or if at a time we want to move ourselves, we can jump over to that open source system, and then we will be able to grow as we see fit. So generally speaking, we probably would like to look at a bigger changeover every 3 to 5 years rather than this last one, which I think took almost 10. So,
Okay, perfect.
And that was one of the benefits of the GovStack over the iCreate, correct? Is that I think it went to that more open source. So it is a little bit more flexible when you, or if you need to move it.
Perfect. Well, thank you, Ms. Grindle. I don't have anybody else in the queue, so I think those are all the questions as I look around. And so even though he's whispering here, I'm not paying attention, I'm going to ask Councillor Carlson to do his motion. Be resolved that the Governance Standing Policy Committee recommend that Council receive the website progress report as information. Councillor Carlson. Thank you, Madam Chair. Oh, just a second. Now. We must have both hit it.
Do I have to push a button? No, I'm good. I could just yell. Thank you, Madam Chair. Thank you, Ms. Grindle. Thank you to your team for the information update. And I think as the committee, we look forward to future updates as we do continuously improve. So thank you. And if there's nothing further, I'll call for the vote.
Okay, question's been called. All in favor? Passes unanimously. Thank you. And I do see our guests are in the foyer, so we should probably go and greet them and bring them in. Thank you guys very much. Well, I think Ms. Hilford's going to go ask them to come in and we'll explain where they are going to sit. And oh, his car might be taking a bit longer to get here. You have to know how to get around the traffic. I know we're still waiting on Mayor Hagan and a few, but well. You can get the sense of our walls that kind of give you vertigo, and you can get used to that before you start talking. It's a very weird wall system in this room.
Sorry, I had to sneak out at the very end there. I missed all the good questions, I'm sure.
And we probably,
I suspect you might have had one or two.
That's why I'm glad to see you here.
and we probably gave you the maze to figure out our roads between there and here to how to figure out how to get, yes, sorry about that too.
I want my staff to get there right away. You need that in the chamber.
You are not allowed to steal that from us, but it's very nice. Welcome, Minister Newdorf. Good to see you. So we're just waiting on Mayor Higgin and a few people, and then we'll get started. All right, so I'm going to call us back to order, and we're going to continue on with, I know Councillor Carlson just ran upstairs, but he's just grabbing coffee, and we'll be back. So how we're going to do this is I am going to invite the mayor up to the podium. He's going to do the welcome and introduce everybody who's here. Because technically, we're still in the meeting, so that's why we have to do it this formally. You have to, no, you have to hit the button and turn your mic on.
All right. Thank you very much. I appreciate this opportunity to be here today, Madam Chair, and to talk a little bit about the intergovernmental health table that has been ongoing for a couple of years and some of the work that has been done. And I will tell you, it's been some exciting work, and today is evidence of that. It's been from one particular announcement to another, and it's been exciting. We were able to open up a treatment facility just outside our community of 50 beds this morning, and I was pleased to have joined by 3 ministers as well as MLAs down at this event, 4 ministers, I'm sorry, and MLAs at that event. The Intergovernmental Health Table was started a couple of years back, and it was an initiative that was brought forward when I was up at a addictions conference in Calgary. And at the time, Chief of Staff Marshall Smith and Minister Ellis, who was in mental health and addictions, thought it'd be great to be able to get together with other members in our community. And the Blood Tribe was there as well, Charles Weaselhead, where I know he's running between different meetings too, and unfortunately he's not here as of yet, but we decided to set up this intergovernmental health table, and I felt quite inadequate. I'll be very honest. When I saw the resume of my co-chair, which is Charles Weaselhead, and the accomplishments that that man has had in our community, and the work that he's done within this particular portfolio has been is welcome to so many within our community. So I do want to give some time to our ministers to be able to, that are part of this, to speak on the intergovernmental health table and what their part and their role is as the provincial government's part on that particular table. So with that, I would like to welcome up to the podium, if I could, first Minister Nixon and followed by Minister Williams, and if Nathan, sorry, Nathan, gosh, I'm sorry. So we'll be able to welcome you up to the mic to be able to speak on this fantastic collaborative work that we're moving forward.
Yeah, I have to say, Your Worship, councillors, officials, I'm very excited about this podium. I do not usually get the privilege of having anything that is close to my height, so this is a big moment for me. I also have to say right off the bat that this is the first time I've been able to address any council in the province with His Majesty's new picture up. So that was a moment for me that took me back a little bit. I'm glad to see him there. So used to seeing, of course, the late Queen always up for my entire lifetime. It is exciting to be here today on behalf of my ministry and the government of Alberta, my ministry being the Ministry of Seniors, Community and Social Services. We're excited about a lot of the work that we've been doing down in the Lethbridge area in partnership with, of course, the municipality, the city of Lethbridge, the county around Lethbridge, as well as some of the amazing nonprofit organizations that work very hard inside your communities that also work very closely with my department on so many issues. With a department of my size with depth of issues, it's always hard to determine what to speak about because there's so much going on, everything from the work that we're doing with people with development disabilities and children facing disabilities and housing and seniors and homelessness. But today I think maybe I'll address what I think are probably the two most prominent issues that we've been talking about a lot with Lethbridge, particularly through the work that the mayor alluded to with the committee. And that is around homelessness. Of course, the side of homelessness, the other side will be addictions, and I'll leave that to my colleague, Minister Williams, to speak about when he gets a moment here. And then, in addition to that, will be housing, and particularly, and I should point out, there's an overlap on those two issues. My first trip down here as minister, I've been this minister portfolio, I've had the privilege of being in your fine city on several other minister portfolios, was in July. And I really enjoyed my opportunity to tour the Blood Tribe shelter. I was very excited about the work that I see taking place there. I was excited to see about the relationship that was being built throughout the community. I don't know if you know, I used to work in the homeless side of things. I had the privilege of growing up at the Mustard Seed and working there for many years, so I have a lot of familiarity with homeless shelters and the work that is taking place there. And I was very impressed by the professionalism and the significant scope of what the Blood Tribe was tackling. And I think it's leading the way and is something that since I left in July that I have brought elsewhere in the province. In Edmonton right now, we are getting ready to open up a new 100-bed Indigenous shelter in the city of Edmonton, for example. We're in conversations for something like that to take place in Calgary. And I see it really as a critical component for us to work successfully with the homeless population, and in particular to connect to the important work that Minister Williams will discuss. So one of my main messages when I'm down here is, what do we got to do to make sure that we get the shelter up to capacity for the snow? It's coming. I don't want to, none of us can say winter's coming no more because of a certain HBO series, but it is coming. And so I've spoken to the mayor and some of your officials, and I really hope that we can overcome that and get it to a spot where we can make sure everybody in Lethbridge is safe and warm for the winter. The other thing I'd like to quickly mention while I was here is housing. Housing is becoming a real significant topic. It always was, but it's becoming a big deal across the country. And I would submit probably one of the biggest challenges of our time. And we recognize that at the provincial government. We're getting ready to invest. We already are investing in significant ways in it, but we're getting ready to invest more. Right now, we're on track to invest $9 billion between now and 2031 in affordable housing. My department's investing $250 million over the next 3 years in things like rent supplements. And we know we're going to have to do more. But one of the challenges that we are seeing is making sure that if we can get the money to the table, that we can actually get buildings built. And some of that is going to be around labor and other issues that I won't talk about today, but we are working on that. But others is going to fall on you. And my message to all municipalities is going to be that we have to work together creatively and look at ways forward where we can make sure projects are getting improved. I was excited to see the new project approved down here with the Lethbridge Housing Authority. Congratulations on that. But that's just the beginning of what we're going to have to accomplish. So my message to all mayors and all municipal councils in the coming months is going to be, we are going to come. The province is going to come. We are going to invest in a significant way. We're going to face this challenge together, but we are going to need municipal governments also to step up to the plate with creative solutions, things around land, but in particular around any red tape within municipalities that could slow up our success. So I'll probably leave it there, other than to say, again, thank you for having us in Lethbridge. Happy to take any questions on the issues I raised today or on anything else that overlaps with my department. And I don't know, am I introducing the next person? Why not? I will ask my colleague, the Honourable Dan Williams, who's the Minister of Mental Health and Addictions, to come up and next to address Council.
Thank you, Minister. Thank you, Council, for inviting me here today. I'll just note that we have been joined by Charlie Weaselhead, who has arrived. So I'm the Minister of Mental Health and Addiction, very grateful to be here today, and I'm in Lethbridge for a very particular reason. We announced this morning the opening of our 50-bed facility of recovery community just outside Lethbridge in the county on Research Road. Using Fresh Start as our operator, this is one of 11 facilities across the province. The second facility that we built is up and running. It was a $19 million capital. We're funding all of the beds inside of that, and we're also going to continue to fund the other 25 beds as Fresh Start takes over this new facility. They're going to have not a co-ed program in one facility. It'll be men in the new facility we announced today and women in the facility they were running co-ed before. I'll note, while I have everyone's attention on Fresh Start, that it is a terrific operator and provider with incredibly high standards, community integration, the work that they have done, and how seriously they take this crisis of addiction and the pride they take in being able to transform these young men and women into contributing members of our society again, literally pulling them back from the brink of death, the edge of overdose after overdose, and instead helping them see that life has value, there's dignity in how they can exit this program, going back to their young families, gaining employment, being good fathers and mothers and brothers and sisters and citizens of our province in the widest possible sense of that word, citizens. It's inspiring to see. So I have nothing but wonderful things to say about the work they've done. And I'm incredibly happy that this is only the second of 11 coming online. As you know, we've partnered with Blood Tribe so that we're able to build another facility there. We're still in the design phase there. We hope to get that one up running as soon as possible. This is concrete and makes a meaningful difference in our communities because we know that addiction, run its course, has one of two ends. It can either end in pain, misery, and death for that individual, or it can be treatment, recovery, and a new lease on life. And I will always choose life over death as a minister that's responsible for 4-point-something million Albertans with an untold number who suffer from this deadly disease of addiction, who flirt with the edge every single day that they try and seek their high and their score. We know that if we don't step in and act as an agent of change and a catalyst for interventions in their lives, we can end up in a spot where we lose more and more. We continue to see public disorder continue and a lack of confidence and trust that we are there to help solve the problem as a society. And so that's my goal, is to work collaboratively with Indigenous partners, with municipalities, with not-for-profits, with individuals themselves and the families as they go through that crisis. So I'm very happy to take your questions surrounding Alberta model, what Lethbridge has been a wonderful participant in as we move forward together, looking to solve this problem and break that cycle of addiction that destroys lives and communities and families, and instead focus on recovery rather than facilitating addiction, get those folks a second lease on life. So with that, I'll welcome up our third cabinet minister and your local MLA, Minister Neudorf, for any comments he has, and then I understand that there will be an opportunity for some questions and engagement with the council, which I'm very much looking forward to. Thank you very much for having me.
Great, thank you very much, Mayor and Council, for having us here. My role on the health table is as Vice Chair, and to bring messages from the provincial government when I don't have the honor of hosting the ministers involved directly. These are typically topics more appropriate for their ministries, so they can give a much more in-depth answer for those on the table. They can also explain more fully how their departments engage with stakeholders here in Lethbridge. So obviously that is always the number one choice, is to make sure that we have those experts in the room to talk directly with our partners in the Blood Tribe, Alberta Health Services, and you as the City of Lethbridge. When they're not there, then I have to do the secondary job of intermediary and taking message back and forth. And I do appreciate the honor and ability to do that because of everybody's busy schedules. I would like to touch very quickly that I appreciate the ongoing conversation with City Council. I think the mayor has reached out. We're hopefully setting up some more regular meetings. And as my ministry looks at affordability, I'd like to share a little bit more with you on that front, particularly the pause and the significance of that for Southern Alberta. It is actually motivated predominantly from affordability, as well as a responsibility of government to make sure that we understand everybody's interest and use of our land. Down here in the Southern Alberta, we know that we are the agricultural corridor. Protecting prime agricultural land for food production in a global food security crisis is of top priority. We also have a gateway to the west, which has a significant amount of tourism, so understanding more fully the impacts of potential renewables project in those corridors is also a land use priority, to make sure we have all of that, as well as making sure that all of our municipalities actually have legal standing before the Alberta Utility Commission, which prior to this pause they did not. And that did cause a significant amount of frustration from a very democratic society, where they would have at sometimes hundreds and hundreds of people, which is a vast majority of their community, sign petitions, and it had no legal bearing on the decisions made. I'm sure this council would fully understand how that could be rather frustrating. So we seek to understand that. And then one of the largest concerns and criticisms of the pause is that it might scare away investor confidence. Well, that is definitely a possibility. I'm pleased to report to this council that 2 days ago, the Alberta Electricity Systems Operator, ISO, released a report of their last aggregated application, forward-looking application process for those willing to connect to our electricity grid. Very nearly 33,000 megawatts of renewable projects were on that list. So these are ones who have not yet applied but would like to hold a place in line for eventually connecting to our electricity system. Giving you some context of what that number 33,000 megawatts means, the peak usage in Alberta at any one time, the maximum amount of electricity consumed on any one given instant is 12,000 megawatts. And we could generate, if every generator was at their maximum capacity, we could generate 18,000 megawatts currently. So to add an additional 33,000 megawatts beyond that is nearly a tripling of our system, which has all of its own unique challenges. So investor confidence does not yet seem to be significantly shaken if there's that many in the queue. And these are part of the problems that we are seeking to understand and show leadership on. And I do look forward to sharing a little bit more with you at some point in time about some of the fascinating work that we're talking about on DSM, demand side management, which actually empowers a lot of individual consumers to really control their own electricity pricing by their usage and by their optimization of their internal system. So more on that later. I do hope you take advantage of the ability to speak to the Ministers of Seniors, Community, Social Services, and the Minister of Mental Health and Addiction directly, as the leading experts right now in our caucus, certainly, in the field, and most suitable to answer questions about their portfolios. I do want to thank them publicly for taking the time and effort to get here. Lethbridge is a long way from Edmonton, and these two ministers, one lives just south of Edmonton, the other lives a little north, and it does take time and effort, and I think all of us appreciate when they take the time to meet us in our community, see it, hear it, feel it, and get questions from you that they can answer to help and better it. So thank you very much for your time.
Thank you. And I know Mayor Higgin, you'd like to come up and introduce your co-chair?
Thank you for this opportunity to introduce co-chair for the Intergovernmental Health Table, Charles Weaselhead, to come up and say a few words.
Thank you, Your Worship. Thank you very much for giving us the opportunity to provide some information on what's been happening around the addiction recovery community. I think the Blood Tribe has entered into many partnership agreements with the city of Lethbridge, including economic development, education, health, and stuff like that, you know. But in the last few years, you know, we've had a tremendous spike in addiction, opioid overdose, and deaths and stuff like that, to where it has a crippling effect with our community. And as most of you know, because of our situation in our community, whether it's housing, whether it's employment opportunities, our people are migrating into cities, especially in the city of Lethbridge, you know. And some of that migration, it carries forward with addiction, you know, those type of things, you know. So given the opportunity to help with the addiction homeless crisis, you know, with the help of the province of Alberta, you know, this is the first time I can recall that our government has put so much investment and resources in this issue, you know. And as I've stated before, you know, many of our people are here. Many of our people are on the street. 70% of those people are in the homeless, you know. So the Blood Tribe has taken the initiative to try to alleviate, to try to help, you know. And I know it's an ongoing issue, you know, and we've been working with the city of Lethbridge, with the mayor, and we've hopefully we're starting to make some headway into that, you know. This morning we had the opportunity to be part of the opening of the center for the recovery community here in Lethbridge, you know. And at the Blood Tribe, we're going to see another 75-bed opening, you know. So it's not that we're going to be piecemealing this issue on addiction anymore. I think we're going full force into it, you know. And I'm just so happy right now that the city of Lethbridge is a huge partner in the investment of those resources to help the addiction crisis that we're in, you know. So again, you know, we've made some documentation, we've made some reports, and hopefully at some point in time we can share those with the city council. So with that, thank you very much.
Thank you. Just so our guests know, this being a standing policy committee, if members of the public are here, they are then welcomed up to ask questions and everything. But I'm going to assume that everyone in the audience is probably your staff. All right, staff, it's your chance now to ask questions of them if you've been wanting to. All right. Nobody seemed to jump up for that one. So we will then move to see if any of my colleagues have questions. Any members of the committee or members of council have any questions? Oh, we knew Councillor Carlson would. Let me. Councillor Carlson.
Sorry, Madam Chair, and sorry, Minister Nixon. I had to sneak out early, so I didn't get to ask you, and I appreciate, I really enjoyed today's chamber discussion and presentation. The video that was presented was amazing. Mr. Jackson, who was there, spoke and really touched my heart. And Mr. Nixon, you sharing your family story with us was very quite profound. So thank you for that. And so, Madam Chair, I hope you'll forgive me if I ask a question on another topic. But since we have the Minister of Housing and Seniors in front of us, I thought, just briefly, and Minister, you mentioned it at the Chamber event today, that if we're not careful, we are going to be, I think you said 150, some thousand houses, units, dwellings, short over the next few years. So was that the number I thought I heard?
Yeah, that is very close number that you did hear. You know, one of the challenges on it, just to be clear, is it's very fluid. I mean, there would have been a moment not too long ago, probably even 2 years ago, where CMHC would have been saying 20,000. And so this is moving, but I think what is very clear is it's getting big. And I would suggest the biggest number that we have seen in the existence of our country. So it's a real challenge. And, you know, some market conditions have not shown up yet, which may impact some of that. But there's a challenge that's ahead of us. There's no doubt about that.
I really appreciate your knowledge about that, and the government's forward-looking to say, you know, we got to be prepared. One of the questions that I had, and if you don't mind me putting on my Green Acres Seniors Housing hat, is we do know that we need a lot of new builds, but a lot of the concern is some of our older buildings cannot be neglected. They don't meet the needs currently for our senior population or the general population for that matter. Is that something that is top of mind? I would hate to us focus on solely new builds and forget about the current stock we have falling in disrepair and then we're still further behind. Is that something that's top of mind for the government at this point?
Yes. And I'd like to maybe just let you know a couple things that are actually taking place on that right now. And I know you're involved in some seniors lodging or housing here, so you maybe take that back to maybe the boards you sit on. We are in the process of this current budget spending $94 million, on capital maintenance and renewal. I just announced the other day an additional $16 million on top of that of new money, though I am pushing to have that $16 million focus on stuff that maybe have went offline so we can get it online as quick as possible. But that's about $110 million that's being spent on it. I've asked my department to come back with an estimate of what we think we could accomplish in a year. I mean, the reality is we all know we need capital maintenance, but we can't do it all at once anyway. And my hope is as I go in the next budget year that I'll have a conversation across the province, but as well as with Treasury Board, about what maybe a long-term plan could be to address that, where we can say it's going to take this many years, but this will be, you know, a stable investment, and then we'll work on it together. But capital maintenance is part of our conversation for sure.
Appreciate that. Thank you, Madam Chair. And the good news is our Minister, Minister Neudorf, has a good long-standing history and knowledge of building and construction. So we rely on him a lot. So thank you.
Well, I'd just say one thing, if I could, to that, Madam Chair, is that you're right about your minister. And when it comes to housing, well, my ministry will be the lead on housing. We are doing this in close partnership. It's in both of our mandate letters with your MLA, Minister Neudorf, because we recognize that this is an affordability issue. And I know I can speak for the minister to say that this is a top priority for both our departments, and I think Lethbridge will be well served of having him at that table.
Thank you. Oh, no, please don't sit down yet. I have a question for you, though. It's a bit philosophical, so if you don't want to answer today, you can always get me the answer at another time. But you mentioned, of course, that you're looking for cities to help with moving housing along. And there is no doubt that one of the things that not just us, but all communities trouble with is rezoning. And so we were redoing our land use bylaw. We're looking into that. But when we look at a place like Japan, 12 zones across the entire country, and it's set at the national level. You look at a place like Houston, where 70% of their community has no zoning. Has our province ever looked at taking zoning back, setting up zoning across the province and saying, these are the zones, housing is everywhere, live with it? And again, it's philosophical if you don't have an answer today, but I'd love at some point to hear your thoughts on that.
I will give you some thoughts on it. I mean, obviously I couldn't commit that we were going to do that.
Of
Mr.
course.
McIver would have something to say, I suspect, by the time I got to the car. What I will say is this, is that almost everything is on the table. Both the Premier and I have been clear about that. There are a couple of things that we've already taken off the table, rent control, for example, because all the experts are telling us it will reduce supply. So we need to go about this a different way. And I mentioned rent supplements may be one of the ways that we do that while we get through the construction process. Minister McIver and I are working very closely on, not specifically that question, but potential changes to the MGA that we can do as a province to help with this issue, but in particular also that could enable some of the things that you're doing. I mean, some of you may have followed the recent debate in Calgary. They went through a fairly lengthy process on this. I think they went 3 days straight, finished at 11 o'clock on Saturday. They passed some pretty significant things I think are going to help with this issue. That's going to make Minister McIver and I have to do some work to be able to make sure they can do it, but we support the ambition. So I think you will see, it's fair to say that you'll see some adjustments, what I would call both red tape and adjustments possibly to the MGA in the context of trying to move forward on this issue. But I certainly will not speak for my colleague, Mr. McIver, but he's at the table to make sure we do that right.
And if you could also give us a different way of funding besides property taxes? I'm sorry, I'm kidding. I'm kidding, I won't go there right now. Thank you very much.
Everything's on the table.
They didn't warn you about me, did they, before you came? Thank you very much. I don't see anyone else in the queue, so I thank you, but I'm sure, sorry. My thing didn't count. You have to hit your button again because I just kicked you out. You're in, good. Sorry, we have new technology, we're still learning.
Yeah,
Councillor
we can figure it
Jones.
out, yes. I have a question for Minister Williams, and at the risk of sounding a little bit, well, maybe a lot pessimistic, the addiction problem to some people seems to be a problem that may not have a solution. And I'm curious whether you're able to keep track of newly addicted versus recovered addicts, because anecdotally, and of course I don't have any stats on it, it seems that the rise in addictions, the newly addicted, seems to far outweigh the recovery or the recovered addicts, especially when part of the process of recovery is relapses. So does your ministry track that? Are you trying to track that, or how do you deal with that?
Because we're talking about how you identify if someone's an addict. Of course, there are clinical diagnoses, but we're not going to be able to clinically diagnose whether someone has a substance abuse disorder for everyone. And there's also the added problem with data sets collection. We don't know the full data set. We don't know if they're telling us the truth. We have estimates, but no one really has a good idea of how many people suffer from addiction in the province of Alberta necessarily. But your larger point, I think, is the increase in new addicts outpacing the ability for us to recover. I think that's exactly the question we need to calibrate right. So how much recovery space do we need? Is this scalable? Is this something we can do as a province? I will say that it's important that we use the right language. The solution to addiction is recovery, and it's not hopeless. And I think we have to keep that language. For fear of letting people who suffer from a deadly addiction think that they can't recover from opioid addiction, right? And I think using that hopeful, positive language that there is a solution, there is a path, there is hope on the horizon, and it's checking yourself into recovery, it's looking for help, it's turning to a family member, it's calling 211, it's going to detox. That, on an individual level, definitely is hope. We believe that building out our 11 different facilities across the province and making sure that they're long-term community-centered recovery are going to meet a lot of the need we see. But as Minister Nixon said today at lunch, we can only build a healthcare and a social benefit system so big if we continue to see more drugs coming into our communities. So it's going to have a question to do with trafficking and enforcement. And I'd say probably an intermediary step, more important than that, is going to be a campaign where we recognize that addiction kills and that drugs are a part of that problem, and that young people, old people, everyone should abstain from these dangerous drugs. And I think that's an important part of the message we have to have, prevention. So good questions. I don't have concrete numbers for you, but they're exactly the kind of questions we're trying to sort through at the ministry.
Thank you. Just this might not be something within your purview, or do you track, are you getting advice or information from experts as to what effect neurologically the addiction has? So if you catch an addict 6 months into an addiction on fentanyl, for example, I can see that the neurological damage would be minimal. But let's say you've got someone that's been living on the street, unhoused for 10 years and have been taking drugs. what are the hopes of recovery, say, for those sorts of folks, bearing in mind the neurological damage that has occurred? And how do you deal with it?
Good questions, and I appreciate the direction you're coming from. And it's tough for us as laymen sometimes to talk about it in an accurate way. But there's two answers I'd go to. To your first question, yes, we do take advice from experts. So I just finished meeting 2 days with my recovery expert advisory panel, of which my good friend Charlie is on, to make sure we have Indigenous input and somebody who understands this space from a local Alberta context. The chair of that committee is Dr. Keith Humphreys, who is professor at Stanford, who wrote the Stanford Lancet Commission, seen to be the preeminent publication on addiction medicine in the opioid crisis in North America, world leader, I would say, in addiction medicine internationally, has worked with a number of different governments, including the Theresa May government, the Boris Johnson government, both in the United Kingdom. He currently works for President Obama, drug advisory, President Biden, and the drug advisory policy, has worked for Obama and Bush in the past as well. So we spent 2 days with him. He is, I would say, one of the highest authorities, and I feel very lucky that Albertans benefit from his knowledge in terms of the nature of addiction and how best to treat it. And so on the second point around data, and I think the best way to think about this is, instead of framing it in the way we have around these late indicators that we see in EMS responses and overdose responses, and unfortunately even deaths, we need to start thinking about this in terms of recovery capital. So to your point, some folks have high levels of recovery capital. Hopefully everyone in this room does. We have families, we have jobs, we have things to live for, we have all sorts of social capital, physical capital, inertia moving us forward as individuals. And if one of us ends up in struggling with an addiction, there's less needed from the outside to support that individual into getting them across that line. But if you look at some of the folks that are going to end up going to the recovery community that we have here in Lethbridge, those folks often have very low recovery capital. And they've tried everything else. They've been in and out of addiction and recovery and treatment multiple times. So we need to look at, are we increasing recovery capital of individuals as they go through treatment? Are they able to maintain, not have recidivism, but maintain their clean, sober, and healthy recovery lifestyle? And that's the data set that we're starting to build. And we're going to have a lot more on that. It's primary for me that we're using evidence, both in terms of the best medical evidence available in the world internationally, and the evidence, are the things we're doing making a difference? Are we actually moving the needle, or are we just spinning our tires? So I'm happy to stand back here in 1 year, 2 years, 3 years, and hopefully after the next election in 4 years, to let you know where we're at on concrete measurables, on recovery capital, and how to get folks who have no other option the help they need, and is it working? Thank you.
Thank you. I understand you have another function at 2:30, so Councillor Carlson, we're going to stop the questions now because they do have something else to get to. We are going to be going into reviewing of a city council policy, so if the other one is boring that you're going to, and you'd like to help us with a policy review, you're most welcome to stay with the committee. But if the other one's more exciting, I would, just want to thank you again very much for coming and giving us the update, and I'm sure we'll see you again soon.
Enjoy the beautiful fall day if you can. Oh, beautiful. I know, and we kept you inside the entire day. Sorry.
Oh, thank you.
Mine was just going to be more of a comment.
Did you like my questions?
I loved your province. Don't beat up the municipality, just take it over.
That's your job. Yeah.
No, I was just going to say, because they talk about the continuum of care, it's when they come out the end of it. I'm just hoping for.
Okay, it's 2:30. Everybody good to
Yes, I'm
get back? Everybody good to continue, or does anybody just really need a break right now? Continue? Okay, so we will go on then to our second presentation on CC 45 policy amendment. And it is Mr. Matthews, I believe, who is leading the charge on this one. Just so you know, you're red now, Mr. Matthews.
Thank you. One of those things being colorblind. Thank you, members of Governance SPC. I'd like to go through today with, thank you, Madam Chair and members of Governance SPC for having me here today to discuss possible changes to CC 45, real estate sales and leases. Mr. Lone and I will go through the presentation or answer any questions that members of Governance SPC have on the proposed amendment to create a subgroup of leases that may be approved by the manager. Next slide. There we go. There's also a secondary amendment to provide clarity through some wording changes, definitions, and to insert missing headings as well within this, the council policy. So to give you some background, on October 19th, 2020, Council amended policy CC 45 to include leases as required, requiring Council's approval. The inclusion of leases into policy CC 45 has cast a broad net that catches all leases, including minor leases for nonprofit organizations. The October amendment also deleted a previously existing heading that specifically delegated certain approval authority to the city manager. Administration believes that there is minimal risk in having shorter-term leases to nonprofit organizations, which are under the dollar threshold set out in the attached revised policy, be approved by the city manager. Allowing the delegation to the city manager will create efficiencies and save administrative resources. Next slide. So there's a number of different options. Option one, which is what we're proposing for Governance SPC to consider to Council, is that the proposed amendments for policy CC 45 will allow the city manager to be the approver of real estate leases to nonprofit organizations that are under 10 years in length, inclusive of renewals, as well as being under $500,000 in fair market value to lease rates to nonprofits. These amendments catch a particular category of leases the city enters into, often below the market value. An example is the city leases two small offices located in the ATB Center to local nonprofit who utilize the ATB Center for their programming. These type of leases typically pose minimal risk, and such risk is mitigated by the terms of the lease agreements in place. The proposed amendments to the policy will not apply to larger, longer-term leases, which are not the lease. Is for they're not for lease for or they are for profit or non-profit groups that are as well. This means leases that will utilize the city's building or land for long periods of time or may attract fair market rates will continue to come to Council for approval. There is also a housekeeping amendment that inserts a missing heading, definitions for real estate, and minor changes between the use of land and real estate. The other options noted inside the report, one is that the City Council rejects the proposed amendments with regards to leases, but approves the amendment to add missing heading. And another option would be that Council does not approve the draft amendments to Policy CC5 and the policy remains the same. Once again, it's administration's recommendation to proceed with option one. This approval will allow for greater expediency in the execution of leases to nonprofit organizations that fall within the set thresholds, as well as easing demands for administrative time. And that's our presentation.
Thank you, Mr. Matthews. And of course, we have no one in the audience, so I don't think the public is here to speak on this. So we will move directly into questions from Council. And I have Councillor Dodick first in the queue.
Excuse me, the question is to Mr. Lowen. It's not that I memorize the Municipal Government Act. It just happened that this morning I was looking at a legal issue involving Section 70 of the Municipal Government Act, dealing with the fact that if you're transferring or conveying an interest in land, which at least says it would have to be at market value. So my question is, in under leases Part A, you don't use the word that the leases will be in market value, and Section 70 seems to suggest that it has to be at market value, failing which it would have to be advertised. So was the intent to have those leases, not not-for-profit leases at market value? Wait for the red light.
The new delegation would apply only to non-for-profit leases, so those ones, but under Part A, those are intended to apply to for-profit leases, and we do those at market value. If they weren't at market value, if there was an exception to that, we would still be bound by Section 70 in addition to this policy. We would
Okay,
have
so
to advertise that.
you'd be bound by it irrespective of whether it's in the policy or not?
Right.
So that's, okay. All right, thank you.
Any other questions from members of the committee? Oh, I thought this would have more discussion because this is why it was a submission and I asked them to turn it into a presentation because I thought there'd be more questions. And now Mr. Lone and Mr. Matthews are looking at me like we could have just done it as a submission.
Well, we all read the submission presentation. So.
All right, so then we can move then on to the motion. And it is a motion from Councillor Dodick. We knew you'd be the one most interested in this. Be resolved that the Government Standing Policy Committee recommend that City Council amend Policy CC 45, Real Estate Sales and Leases, as set out in Option 1 of the CC 45 Policy Amendment Report. Councillor Dodick. Oh, now.
After lengthy submission, presentation, vigorous, and questioning and answers, I would ask that council support this unanimously. Call the question. Oh, yeah, council's sitting as a committee. What committee?
We're just a committee today.
Yeah, which one? Okay. Just curious.
Okay. Question has been called. All in favor? Passes unanimously.
Yes.
Go home, everybody. We're adjourned.
Thank you, Madam Chair. Thank you. Nice to see you, John. When did you get home?
Yeah, website was before the ministers came.
Oh, you must be exhausted.
We took it as information.
No.